ます。その時にやっぱりどうしても首都圏見ることがあると思うんですけど、首都圏は首都圏で一つの証券なので、首都圏に行かなくても急にいきなりグローバルに行くことも全然僕は地域からも可能だと思います。なのでこの後、ピッチをするスタートアップに関しましても、もちろんグローバル展開が前提になっている企業が多いので、もうボーンローカルゴーグローバリーの精神を持ってですね、ぜひいろんな方に活動して成長してほしいなというふうに思っております。はい、よろしいでしょうか。はい。じゃあ、前半の、ユニコーン広島県のスタートアップ支援に関わるセッションはこちらで終わりにしたいと思います。じゃあ後半ですね、ここに今日このブースにもいますけれども、スタートアップ企業の、ピッチがございますので、後半からは、英語のピッチになると聞いてますので、よろしくお願いいたします。はい。それでは、松本さん、山木さん、どうも今日はありがとうございました。
ありがとうございました。
ありがとうございました。
では、はい、切り替えをお願いいたします。はい、では1社目ですね、プラチナバイオさんの、ピッチになります。ご準備よろしいでしょうか。はい、では、よろしくお願いいたします。
Hi, everybody. I'm from PT Bio. I'm the Chief Strategy Officer, Yumiko Kusakabe. Nice to meet you all. Today, we want to talk about our bio design activities from Hiroshima University. PT Bio is located in Hiroshima University Genome Editing Center inside the campus, and we consist of about 35 employees, and including 20 scientists. Our core technology is bioinformatics and genome editing technologies, which we apply to all these sectors like climate change, biodesign, healthcare, agri-tech, and food tech. Our scientific leaders are Dr. Takashi Yamamoto from Hiroshima University. He's the leader of the Genome Editing Academic Society in Japan. And Dr. Bono is the leading scientist in bioinformatics area. Our management team consists of Keisuke Okuhara, who's the CEO. He has a lot of experience in strategic projects in governments. And I myself have a financial business background. I'm the Chief Strategy Officer. CEO is from consulting background. And the scientific leaders are shown on the right. Our core technology consists of the capabilities to be able to screen different species, from plants to animals to cells to fungus to anything. We can analyze the biodata. We have our core proprietary genome editing technology that is called Platinum Talon, which is comparable to the Nobel Prize winning CRISPR-Cas9 technology. And we can provide gene editing tool services. Today, because of the short time, I want to introduce our core interesting product called Egg for All. This is allergy-free, the world's first allergy-free egg product that we can provide delicious food products for egg allergy patients. So in the world, there is 60 million egg allergy patients, and the children in the family get affected from the quality of life of not being able to eat eggs. So the typical symptoms are like sneezing, nausea, diarrhea, but some severe symptoms could be like anaphylexia as well. So these egg allergy patients actually have to avoid egg all their life just because of the allergen that is problematic in the egg protein. So just to explain our solution, actually, in the eggs, there's an egg protein called ovomucoid, which is, even after heating, that remains. So because of this ovomucoid, the egg allergy patients cannot eat egg all their life, and the families get affected as well. So our solution is that from the egg, we have removed and knocked out the ovomucoid, and now we can create completely egg allergy-free food. Our traction is that actually we are receiving great support from the Ministry of Agriculture of $9 million of equivalent research budget. And we have a wonderful partnership with Kewpie, the leading mayonnaise company. And also, our clinical trials were successful to prove 100% safety. Also, we got support from Mitsubishi Corporation in Silicon Valley. And also, the construction of the production site in Kumamoto Prefecture is now complete. Just to introduce, this is the NHK television program showing a small child who, for the first time, was able to eat an egg and egg food, and his mom and the child is very happy that he was able to eat delicious egg food, and he wants more. So that egg powder is the product that we have, which is completely allergy-free for the first time in the world. This television program was translated into 18 countries in the world. So these are the Dr. Bono and Dr. Yamamoto's leaders, scientific leaders. And now our activity spans into US, Malaysia, and also we are starting to go into India these days. We just signed a MOU with the university, the National University of Malaysia called Malayan University. And also we have a MOU for joint research with Sunway Innovation Lab, which is the largest conglomerate in Malaysia. This is our activities in Silicon Valley. We got accepted at Japan Innovation Campus, so now we have an office in Silicon Valley. And we are doing consumer studies with Kitchen Town, a leading food innovation research company. We actually pitched in the Future Foods Tech Summit in London and also in San Francisco. I'm just showing some of the meetings that we had with Cargill and Nestle and whatnot. And then also we had a booth exhibit, and we were the only Japanese startup attending this whole food tech summit. And this is sort of the virtual booth. And we were able to have great one-on-one meetings with many European and US international companies. So with this product, we want to create an allergy-safe, smile-rich world for many kids. Thank you so much.
ありがとうございました。では、はい、入れ替えをお願いいたします。では、次は中野さんですね。はい、では、マテリアルゲートの中野さんになります。プレゼン6分になります。よろしいでしょうか。
はい、大丈夫です。
はい、ではスタート。
はい。Hello everyone. It is an honor to be here. My name is Yuki Nakano. I am president at Material Gate. というところで、ほぼ日本人なので、多分日本語の方が分かりやすい気がするんで、もう日本語で喋ろうかなっていうふうに思っています。まず最初なんですけど、私も2年前に創業したんですけども、その時実はジェトロさんとか県庁さんのアクセラプログラムから起業前から始まって、もちろんフォーストさんもサポート、してくれまして、でその後、先ほど言われていたユニコーン10という、いわゆるアクセラプログラムで去年ぐらいに最優秀賞をいただいて、いろんな投資家さんに紹介していただいて今につながるという、そういう会社でございます。で、事業に関しましてはこれも英語で言うとまた眠くなる気がするんで専門用語ばっかりでちょっとサクッと日本語でも言っちゃおうかなと勝手に思います。すいません、なんかど無視して。はい。 というところで、我々広島大学初の、スタートアップでございまして、単分子誘電体という材料、シングルモレキュラーエレクトリット、SME というものを、我々、扱って今メモリデバイスというものを、作っております。よいしょっと。はい。でまず我々の、フィロソフィーなんですけども、素材の力で未来を作るというところで、Creating Future with a Material というところを、我々、ミッションにしております。で私もまだ思ってるんですけど、日本の産業、特に素材産業って今日本の力がどんどん弱くなっていると言われている、昨今ですけどまだまだ強いというふうに、思っておりまして、私としてはこのユニークな材料をしっかりと使って日本の産業をこう盛り上げていきたいというふうに、思っている、ところでございます。はい。で、じゃあ我々どういうことで今この素材の力でいろいろ世界を変えようというふうに思っているかという、ところなんですけども、今我々が取り組んでいる課題というのがこの昨今言われております、AI とかビッグデータ時代に、非常にこう増えてきておりますコンピューターの消費電力ですね、これを素材の力で、ぐっとこう下げてやりたい、そういうふうなところを、今、我々取り組んでおります。じゃあどういうふうに、それを下げてやるかというところなんですけども、これが今のコンピューターの形と我々が目指しているコンピューターの形でございます。でコンピューターってCPU とメモリからできてるんですけども、基本的にはCPU たくさん消費電力を食ってるんですからメモリも結構消費電力食っております。で何が悪いかというと今一番使われているメインメモリというのが DRAM と言われる揮発メモリ、ボライタルメモリっていうんですけども、これがかなり消費電力食っているので、我々は新しい材料、この SME という材料を使ってノンボライタルメモリ、いわゆるその電源切っても消費電力、ごめんなさい、電源切ってもメモリがちゃんと保持されている、そういうメモリを作ってやろうというふうな、ところを目指しております。じゃあどういうそのものなのか、この単分子誘電体というものがどういうものなのかというところでございます。でメモリって今世の中にたくさんあるんですけども、こう電気的にプラスとマイナスで01を記録するメモリというものが、フェロエレクティックメモリFE-RAM っていうんですけども、こういうのがございます世の中には。でこの FE-RAM って世の中のメモリのうち、一番速くて一番消費電力が少ないんですけどちっちゃくできないっていう、そういう課題がありまして、コンピューターに入れなかったっていう、そういう歴史的な背景ございます。で、それを我々の材料、この FET のいいところ、ごめんなさいFE-RAM のいいところをそのまんまに、ちっちゃくするようなことが、できましたというところが我々の材料の新しいところで、要は速くてちっちゃくできて消費電力が高い低いというところが非常にイネボーティブなところというふうに、ありまして、我々これで材料開発を、進めて、おります。で実は今回私初めてメモリのプロトタイプをブースに持ってきているので、ちょっとぜひ見ていただきたいんですけども、今我々何をしているかというと、材料を半導体のウェハーの上にこうつけて、でコチョコチョコチョってやってデバイスを作っているということを今やっております。ちなみに2年後に絶対にメモリのプロトタイプを作ろうというふうに、そういうふうに思っております。で我々じゃあ先々何をしていくかというふうなところなんですけども、基本的にはメモリ屋さんなんですけども、材料屋なんで材料を売って、で材料をこう使いこなしてもらうための、ライセンシングっていうところを、お客さんに、使ってもらうという、そういうビジネス、モデルをやっております。で最後になりましたが一応、英語というところだったんですけども、英語でのディスカッションの方はまたブースでというところでI would like to、そうですねyour help achieving our mission でI'm looking forward to more English discussion at our booth というところでまた引き続きよろしくお願いいたします。
はい、ありがとうございました。ぜひ、この後ブースの方で、多くの方に来てもらいたいと思います。では、切り替えをお願いいたします。
Hello everyone, thank you for your attendance.
はい、はい、ではお願いします。どうぞ。
Hello everyone, my name is Kohei Shimasaki. I'm from Hiroshima University. So we are preparing to establish our company in this year. So we needed to get support from global aspect. So Today, I would like to explain about the real-time vibration visualization camera. So this is our research output. So we would like to implement a social product. First of all, I would like to explain about the problem. So there are several social issues such as labor shortage and maintenance relying on the individual skills and aging equipment. Then currently, a strong demand is from time-based maintenance to condition-based maintenance and further to predictive maintenance. Then there are some challenges. First of all, it is very difficult to install the sensors in location with high press or high temperature or high pressure. And then we need to require scaffolding on equipment shutdown, resulting in high cost and high risk operation. This is value proposition. After installation of this high-speed vision-based visualization camera, we can get some health condition of the equipment and machine. So I would like to just introduce this technology. As you can see, left side video, these green vectors are all our software sensors. After getting this information, we can get the health condition or vibration mode of the target object. Then we can estimate health condition of the target object. So this is unique value. After trying some experiment for bridge, as I mentioned, these red vectors are all our sensors. After getting this information, we can estimate this kind of vibration model information from the actual object. Then we can implement into the 3D model. This is not a simulation, this is actual output after magnifying the actual movement. Then we need to integrate PDM solution to transcend individual devices enabling by mapping high-speed image dynamic features onto 3D models. This is underlying magic. There are 3 features of our technology. First of all, vibration visualization, as I mentioned. Then, second one, wide range immediate measurement. In this case, we are just controlling the zooming up images using the high-speed switching mirrors. Finally, this is the most important features of our technology. We can implement real-time processing. After getting the actual information, we can control, we can utilize visual feedback to the robot or drone or such kind of control method. This is business model. In the case of initial phase, we can just installation of this product, and then subscription model, we can make some contract. Then growth phase, we are moving to SaaS-based diagnosis device services. Then finally, we will achieve the fundamental technology for autonomous, non-contact, and maintenance after that. This is go-to-market. So we would like to achieve the 60 billion US dollars market. So we are focusing on the predictive maintenance market in all over the world. This is just a plan how to go to global market. First of all, we just verify the accuracy of our technology in the domestic country. Then we can go to US or Singapore or such kind of global market. So this is a competitive analysis. Our technology want to focus on the coverage and the continuity. This is our only solution. We can conduct a non-contact continuous wide area to measure the health condition of the target. this is team introduction. After this presentation, I needed to go back to Hiroshima as soon as possible. Then he is one of my business partners, so you can ask him about our company. So this is the projection. 2030, we will try to achieve 6.5 billion Japanese yen. This is the sales amount of sales. Finally, this is our dream. After utilizing our technology, we can grasp the actual condition. Utilizing our camera, then we can just implement the digital twin. This is like kind of digital and analog world into the same dimension. Finally, we are just looking for embedded engineers and server engineers, and then we are recruiting the CX position for the strategic partner and the investor to go to global market. Thank you for your attention.
ありがとうございました。はい、では切り替えの方お願いします。では、ご用意よろしいでしょうか、相田さんですね。はい、では6分です。どうぞ。
And thank you for giving me the opportunity to speak today. I'm Yu Mizuno, ophthalmologist and physician in IVITAS, and that is aiming for preventing blindness around the world. That is AI-enabled smartphone device for low-cost early detection for eye disease at any time. As you know, 2.2 billion people are suffering from visual impairment around the world. 19% can be treated, even if in the terminal stage, that is cataract or myopia, that is the anterior segment part of the eye disease. However, posterior segment part of eye disease, such as glaucoma, diabetic retinopathy, or age-related macular disease, they have treatment now, but they have to start their treatment from the early stage, and if not so, they will become blind. However, these diseases have characteristics that the patient feel difficulty in their eyes. The disease are already in the terminal stage, and starting treatment from this stage do not prevent them from blind. And currently, posterior segment part of the eye can only be observed by the ophthalmologist using specific lens and light. So, for this reason, at least 10 million are being missed due to the limited access to the eye care service. So, we create the smartphone connected ocular fundus camera so that anyone, anywhere, easy and low cost to observe posterior segment part of the eye. So, this is what our unique AI algorithm enables retinal images for simple attachment as the smartphone for device. In our competitor analysis, the most major device for is the desktop type of ocular fundus camera. It can take clear ocular fundus images, but large and expensive. And they already have portable or smartphone connected ocular fundus camera. It can take clear ocular fundus images, but still expensive. Then we can launch our device for extremely low cost because of our AI algorithm. And our device also includes the AI diagnosis for the screening. So using our device, we can start treatment from the early stage to prevent blindness. And this is our business model in Japan. We have two sources of revenue. First for the device charge, and second for the system usage fee as the SaaS system. The market size is estimated only for the ocular fundus camera is $3 billion for global, and the market is expected to expand due to the aging. And this is our R&D strategy. We are starting clinical trial in Japan now, and we are now preparing for the global clinical trial in US, Australia, and Indonesia. Then our team includes ophthalmologists, experts for the AI, hardware engineer and business. And why we are today is that we are looking for the professional person with a deep understanding of the clinical process and needs of GPIC in global. And we are now looking for the financial assistance for 1.5 million US dollars seed funding for the clinical trial. And please contact us. Thank you.
ありがとうございました。はい、以上で、広島県のピッチは、終了に、なります。この後ですね、左手のブースの方に皆さんいらっしゃいますので、興味がある方いましたらぜひごそのまで足を運んでください。よろしくお願いいたします。はい。じゃあ山木さんこれで終了ということでよろしいでしょうか。はい。So thank you for listening to our pitch and see you at our booth. You're waiting for. じゃあ終わります。
ありがとうございました。広島県によるプレゼンテーションでした。